Question number 1 is a 65-year-old man presents with painless hematuria. IVU is normal. Prostate is mildly enlarged with mild frequency. What is the most appropriate next step? Option A is ultrasound abdomen. Option B is flexible cystoscopy. Option C is MRI. Option D is nuclear imaging. Option E is PSA. So in a 65-year-old man, prostate is mildly enlarged. It is the normal thing in a 65-year-old man, and he is present with painless hematuria. So painless hematuria, it is for bladder cancer. Painless hematuria is in bladder cancer. So in vitro ureterogram is also normal in this case. So our next step is flexible cystoscopy to see the bladder for seeing bladder for it has cancer or not. So our correct answer is option B, flexible cystoscopy. Question number 2. A 74-year-old smoker presents to his GP with cough and shortness of breath. Examination revealed pigmentation of oral mucosa and over the palms and soles. Tests showed that he is diabetic and hypokalemic. What is the most probable diagnosis? So its correct answer is ectopic ACTH. So a 74-year-old man present to his general physician with cough and shortness of breath. So further examination revealed pigmentation of oral mucosa and over the palms and soles. Tests show that he is diabetic and hypokalemic. So probable diagnosis is ectopic ACTH. This pseudo-Cushing syndrome is also linked with ectopic ACTH. So our main diagnosis is ectopic ACTH. Question number 3. A 44-year-old woman has lost weight over 12 months. She has also noticed episodes where her heart beats rapidly, tachycardia, and strongly. She has a regular pulse rate of 90 beats per minute. Her ECG shows sinus rhythm. What is the most appropriate investigation? Option A, thyroid antibodies. Option B, TFT. Option C, ECG. Option D, echocardiogram. Option E, plasma glucose. So our correct answer is thyroid function test or TFT. So 44-year-old woman has lost weight over 12 months and she has tachycardia and her ECG, and she has lost weight and she has tachycardia. So our most appropriate investigation in this case is thyroid function test or TFT. Question number 4. A 79-year-old anorexic male complains of thirst and fatigue. He has symptoms of frequency, urgency, and terminal dribbling. His urea and creatinine levels are high. His serum calcium is 1.9 and he is anemic. His blood pressure is 165 or 95 mmHg. What is the most probable diagnosis? Option A, BPH. Option B, prostate carcinoma. Option C, chronic pyelonephritis. Option D, benign nephrosclerosis. So a 79-year-old anorexic male. So he's anorexic because he is not eating proper food or he is not taking proper nutrition, and he complains of thirst and fatigue. So he has symptoms of frequency, urgency, and terminal dribbling also, and his urea and creatinine levels is also high. His serum calcium is 1.9 and he is anemic. So what is the most probable diagnosis? So his probable diagnosis is option B, is prostate cancer is probable diagnosis. Question number 5. A 64-year-old man has recently suffered an myocardial infarction and he is on aspirin, atorvastatin, and ramipril. He has been having trouble sleeping and has been losing weight for the past 4 months. He does not feel like doing anything he used to enjoy and he has stopped socializing. He says he gets tired easily and cannot concentrate. What is the most appropriate treatment? Option A, loperamide. Option B, dosulopane. Option C, citalopram. Option D, fluoxetine. Option E, phenylazine. So our correct option is citalopram, because it is safe in because citalopram is safe in myocardial infarction, and he has been having trouble sleeping, and he has been losing weight for the past 4 months, and he stopped socializing because he is in depression. So the safest drug and most appropriate treatment here is citalopram, because it is also safe in myocardial infarction. Question number 6. A 67-year-old man after a stroke presents with left-sided ptosis and constricted pupil. He also has loss of pain and temperature on the right side of his body and left side of his face. Which part of the brain is most likely affected? Option A, frontal cortex. Option B, cerebellum. Option C, pons. Option D, medulla. Option E, parietal. So the correct answer is option D. So here a 67-year-old man after stroke presents with left-sided ptosis, constricted pupil, and that is a sign of Horner syndrome. He also has loss of pain and temperature on the right side of his body and left side of his face. These are symptoms of Wallenberg syndrome. So part of which part of the brain is most likely affected? So medulla is most likely affected. So it is the most probable. It is the most likely affected area. Question number 7. A 60-year-old man presents with dysphagia and pain on swallowing both solids and liquid. A barium meal shows gross dilatation of the esophagus with smooth nerving at the lower end. What is the single most likely cause of dysphagia? So its answer is option A, achalasia. So the 60-year-old man, he presents with dysphagia and pain, difficulty swallowing both liquids and solid. Male shows dilatation of the esophagus with smooth narrowing at the lower end. The single most likely cause is dysphagia. What is the single most likely cause of dysphagia? So likely cause is achalasia. Question number 8. A man undergoes a pneumonectomy. After surgery, investigations show hyponatremia. What could be the cause of this biochemical change? Option A, removal of hormonally active tumor. Option B, excess dextrose. Option C, excess colloid. Option D, excessive potassium. Option E, hemodilution. So the correct answer is hemodilution. So a man undergoes a pneumonectomy. Pneumonectomy is a procedure where one lung is removed, and after surgery, hyponatremia. Investigations show hyponatremia. Hyponatremia after pneumonectomy is due to SIADH. So here the correct answer is hemodilution. Hemodilution is its mean is accumulation of water in the blood. So the correct answer is option E. A pregnant lady presents with pain in her calf muscles with local rise in temperature. What treatment should be started? Option A, aspirin. Option B, low molecular weight heparin. Option C, paracetamol. Option D, cocodamol. Option E, aspirin and heparin. So a pregnant lady presents with pain in her calf muscles. So because of pregnancy, the treatment should be started with low molecular weight heparin. So other options like aspirin and these are contraindicated to a pregnant lady. Question number 10. A 53-year-old female presents with an acute painful hot knee joint. She is a known case of rheumatoid arthritis. On examination, the knee is red, tender and swollen, hamstring muscles are in spasm. Temperature is 38.5 degrees centigrade and blood pressure is 120 or 80 millimeter of mercury mmHg. What is the single best next investigation? Option A, joint aspiration for cytology and culture and sensitivity. Option B, joint aspiration for positive birefringent crystals. Option C, joint aspiration for negative birefringent crystals. Option D, blood culture. Option E, serum uric acid. So the correct answer is option A, joint aspiration for cytology and culture and sensitivity.